Hello and welcome. I'm Uveka Rangappa. Now, October is Mental Health Awareness Month. So, in our Health and Science Focus today, we've decided to take an in-depth look at bipolar disorder, which seems to be on the increase here in South Africa. According to the SA Depression and Anxiety Group, that's SADAG, over 4 million people in South Africa actually have bipolar disorder, which is also known as manic depressive illness. It's a physical illness marked by extreme changes in mood, energy and behavior. It requires intensive treatment, and there's certainly a lot of stigma surrounding this mental illness. Well, today we'll get a clearer picture of what exactly bipolar disorder is, how you treat it, and how you actually live with it. We'll hear from the medical experts. We'll hear from a mother living with bipolar disorder, and her daughter will also be here to talk about living with and supporting someone through this. We'll also chat to a woman who has written a book about living with bipolar disorder. So what exactly is bipolar disorder? Let's take a look.
Bipolar disorder, which used to be called manic depression, is a mood disorder which can cause your moods to swing from an extreme high to an extreme low, with episodes called mania, hypomania and depression. There are different types of bipolar disorder, and you will be diagnosed accordingly depending on how often you experience symptoms and how long these episodes last. The cause of the disorder is not completely clear, but it is believed to be a combination of genetic factors, a chemical imbalance in the brain and environmental factors. So what are the symptoms? According to the charity Rethink Mental Illness, symptoms of mania can include feeling very happy or excited, being full of new ideas, talking very quickly, being easily distracted, not being able to or wanting to sleep, and making big, unusual and potentially unwise decisions without thinking them through. The symptoms of depression include having less energy and feeling tired, hopeless or negative, guilty, worthless or helpless, and having thoughts of death or suicide. During severe episodes of mania or depression, a person may experience psychotic symptoms such as hallucinations and delusions. How can bipolar disorder be diagnosed and treated? You should first see your GP, who will refer you on to a psychiatrist who can make the diagnosis. It can take a long time to be diagnosed with the condition because it shares symptoms with other mental health disorders and affects everyone differently. Medication is used to treat the disorder, with sufferers usually given mood stabilizers to manage their symptoms. You should also be offered help through talking, such as cognitive behavioral therapy.
Well, that is our health focus today, bipolar disorder. Let's discuss this further now with Dr. Leigh Janet from the South African Society of Psychiatrists. Dr. Janet, good morning and thanks so much for your time. I'm hoping you were able to hear some of that explanation. Is there anything you'd like to add to that in terms of where we are today when it comes to bipolar disorder and what we know about it?
Good morning, and good morning to the viewers, and thank you for the opportunity to contribute to this important discussion. I think that the key thing about bipolar disorder is that you have an episode of mania. That is what is required to make the diagnosis. So it's not always the mood is going up in mania and then depression. Some people may start with 3 or 4 depressive episodes and only experience a manic episode many years after the depressions have started. So only many years later then do we get to the correct diagnosis. And so one of the problems is that the treatment for depression that is not bipolar is slightly different from the treatment for depression that is a bipolar. And so some people have already been exposed, in a way, to less than optimal treatments. But because we have no other way apart from clinical to make the diagnosis at the moment, we are still stuck with that. I just want to emphasize that mania and depression, they're episodes, they occur in people, they're a big shift from what the person is usually like, and after treatment hopefully the person returns to normal. And it's during the episode, and especially in mania, where a whole lot of very disruptive behaviors occur, and the person is not aware that they're not well. They have this wonderful surge of well-being, and that's the deceptive part, because you suddenly feel that's so powerful and special, and often engage in all kinds of reckless or ill-judged decision-making, spending money, opening businesses, starting many things. I suppose the big clue should be, I have only slept 2 hours a night for the last 3 or 4 or 7 nights. And so one might think that a person would think that's not really usual, but the good feeling, the great feeling, is it drives the people on And they seldom, especially early in the condition, they seldom realize that this is part of not being well. Of course, the manic episode then is very disruptive for, say, the marriage or a relationship, because the person in mania might have affairs, not just spending money, speeding, gambling, giving their money away, doing all kinds of things while they're suffused with this surge of energy.
Doc, well, it does sound like a hell of a lot that does come with this particular mental illness. Let's just go back to basics there. In that little piece, we heard that there's very little known or next to nothing known about what could cause bipolar disorder. Is it genetics? Is it something that might trigger? Is it a traumatic episode? You spoke about depression. Does that often lead to bipolar disorder, or is it a sign that it's coming? Can you give us some clarity on what we know that might cause it? Are we getting any answers these days?
No, I think at the moment causes are moving a bit further away, because we're starting to see that the genetics is far more complicated than we thought. If there is early life adversity, early life trauma, that complicates just about any other psychiatric illness, and that includes bipolar disorder. So that's an additional factor that when the person does later present, which usually happens with bipolar disorder in the teens, when one does present with the mood episode, the early life adversity complicates the management over the medium term, because that trauma will usually make the condition's presentation a little bit more severe, and especially the depressions are more difficult to treat. There are environmental factors such as stress and work stress, but these people who are prone to getting mania often have a baseline natural energy that is probably above average. So they are the people who can work themselves ill by continuously working and short nights and working. And that can be the trigger for the episode.
So, Doc, you get people who are moody sometimes. People go through maybe bouts of depression. It might last, a couple of weeks, a couple of months, depending, like you say, on those environmental factors, whether something is happening in their lives at the moment. But what are the common signs and symptoms that someone like you would look out for when you're questioning a patient, for example, that might lead you to that diagnosis of bipolar disorder?
Okay, so we need to have mania. So mania is the surge of energy, at least 7 days without normal sleep, much reduced sleep. For hypomania, which in a way is a milder form of mania, 4 days of this. The person is talkative, their mind is racing, they can't focus on things, they're very active. It can be random activity, but it can also be goal-directed activity. And then there's this poorly judged activity. When the person is depressed, it looks very much like the severe major depression that we know. And I think we must realize that bipolar disorder is on the severe end of the spectrum. So it's unusual to have mild episodes of depression in bipolar. So when someone has severe depression, it goes with marked change in what their usual state, marked flattening of energy, although sometimes they can be restless, marked reduction in sleep, although sometimes they can oversleep, marked change in cognitive ability, where the brain is usually just unable to concentrate and pay attention, big change in function. So in the mania, the change in function looks like a surge in function, but the output tends to be low. In depression, there's just flattening. There's very little function. The person can easily spend 3 or 4 weeks just lying on the bed, and just to get up and clean the teeth or have a shower can be an effort and only happen once a week. And this is clearly not what the person is like usually.
Doc, is there a particular age that you would see the onset of bipolar disorder? Does it happen, for example, let's say, we have teenagers when puberty is sort of setting in? Would you normally see that? Or can this happen in very young children? Can it happen when you're very young? Would you see signs then?
It is described in young children, but the commonest presentation is roughly between the ages of 15 and 30. It can even onset in people in their 60s or 70s, where they maybe have had 2 or 3 episodes of depression in their life, and then very unusual, you could see a manic episode in somebody of 60 or 70. Often that's a sign there's a medical cause, and when we're assessing somebody for bipolar illness, especially with a manic episode, but even with depression, especially the first onset, we do a whole lot of tests, medical tests, brain tests, physical tests for a number of medical illnesses that can imitate the condition.
All right. So I've also read in doing research for the show that there are different types of bipolar. Is it true? And how many, and what would be the difference? How do you sort of categorize them?
So the big distinction is the bipolar 1, where the mania is more severe and lasts longer and almost always results in a hospitalization, sometimes even an involuntary hospitalization, because the person is not aware that they are ill, but they are engaging in all these self-destructive behaviors. And then hypomania, which usually does not result in hospitalization, but where the person is more energetic, more talkative, maybe more argumentative than usual, still sleeping less than usual, maybe spending money but not blowing the bank, doing things that the family and the people who know the person well can see this is not their usual state. But because this is such an unusual condition, most people don't really know what to do. The role of the family in detecting, monitoring, and even sometimes aggravating the condition, which is understandable because suddenly the person is now argumentative and fighting with you. But when one realizes that there's something amiss here, my mother doesn't usually scream and shout like that, probably we need to consult with somebody. Of course, the person who's in the hypomania or the manic state does not think they're ill. They do not need to consult with anybody. And so this standoff is a very common thing that happens often until something really dramatic happens, and then medical intervention becomes necessary.
Well, let's talk about that medical intervention from your side, from a psychiatrist point of view, because we know there are a whole lot of experts that are needed to actually treat bipolar disorder, especially when it's as severe as you described, Doc. What is it? Is it medication, and is it stuff that you would have to take for the rest of your life, and what are the side effects of those, if any?
Sure, lots of answers there. So the important thing, in the acute mania, which is usually an extreme state, the person usually needs to be treated in hospital. Fortunately, we have quite efficient medicine for the treatment of mania. Even though mania is one of the most extreme states of mental disability that one can see, the treatments are usually effective, and the person can come out of the manic episode. Unfortunately, although the medicines are effective and efficient, they have a lot of side effects. And commonly during the treatment, the person who's coming down from mania towards a more normal mood, which we call euthymia, is often blurry, slurry, confused, and may have very little recollection for actually what happened during those first 2 or 3 weeks. Once the mood has come more under control, that's when the real treatment starts, because then we have to try and educate, and that's a very important component of all mental illness, but bipolar especially, because when the person has recovered, they're now fine. And they look back and they can't remember fully what happened, and they don't appreciate necessarily the harms they got up to at the time. And so they're set to repeat the problem again and again until one can persuade them that maybe they need to remain on some mood stabilizing medication to try and keep the episodes away. And again, the medicine is not completely efficient at that. It's quite good, but it's not completely efficient. We could do a lot better with better medicine. In that phase of recovery, when we're thinking mood stabilizers, we're also thinking support for the family, educate the family, try and get them to understand, because often when there was fighting and complications during these mood episodes, family disruption has happened. We speak to the boss at work, not necessarily, we can't really give them too much information. Yeah. That's why a program like this is very useful, because they can see that when that person was behaving like that, and now they've been in hospital, and now they've come back, and in the beginning, some of the medication might even be apparent. You can see they're still on high doses as the medicine is brought back down. The boss could be wise and see, he's worked so well for the last 15 years or 5 or 7. This was something unusual. Let's give him a chance and maybe get HR in and so on. There are a lot of people involved, personal therapy, and even for the patient themselves, keeping fit, not smoking, not drinking, not taking drugs, eating a healthy diet, making sure that you get your good night's sleep, trying to avoid the triggers. Yeah. So for some people, it's taking drugs and so on, trying to avoid those things that may set off another episode, which people learn along the way, because these are very unusual episodes that people do not have a natural understanding of. It's not like pregnancy, where we all sort of know what's going to happen. This is completely unique, and most people have never seen anything like it, which is why it sometimes gets away from us.
Yeah. All right, Dr. Leigh Janet, thank you so much for that very in-depth discussion there, and also very helpful as well. If you're wondering what's going on with a family member, you can't quite put your finger on it. It doesn't necessarily mean that they have bipolar disorder, but it might give you a clue, especially if they actually do. Now you may have some idea as to what you can look out for. Well, we'll continue with our discussion on this pertinent topic, bipolar disorder. When we come back, we'll chat to a psychologist, because as we heard Dr. Janet say, it takes a lot of people to help treat and support somebody who is going through this. That's on the way.